We go. My name is Bryant Sikorsky. I'm an independent financial planner and wealth advisor here in Cary, North Carolina, just outside of Raleigh, North Carolina. I help individuals and small business owners make good decisions with their money, and I'll typically do that through some sort of insurance, education, financial, retirement, or retirement income planning. Phase two would be implementation of stocks, bonds, and mutual fund, and maybe different types of insurance, life, disability, and long-term care. And then really step or segment number 3 is ongoing consulting with my clients to help them with required minimum distributions, legacy planning, tax issues, market performance, etc. So thank you very much for being here. Today we're going to be talking about Social Security, Medicare, and your retirement. And I have to admit I had a different slide deck in mind, but as I looked at it, it really didn't bring enough value to the table for me. So I've switched, and what I've done is I've actually got 2 separate presentations now that I'm going to do one after the other. And I think the first one shouldn't take more than about 25 minutes, and the next one about the same. But if it gets too painful, this way, if you don't want to know about Social Security, or if you don't want to know about Medicare, you can drop off and go back to my YouTube channel and catch it later. So today I'm going to try to help you understand how Social Security and Medicare programs work, discuss the issues that both programs are facing, and outline some effective strategies that you can take into consideration when working with these 2 different programs. So with that, I'll just make sure that Mr. Technology here works for me, and see if we can get to the next page here. There we go. Oh, it's wonderful when things work. So I would ask you to think about, what is your retirement income picture? For everyone that's on this call, it's going to be a little bit different. Some of you may still have a pension from an employer plan, or some of you, or most likely, you're going to have a 401k or an IRA. Some of you will maybe keep on working or have other rental or other types of properties. So all of these factor into your income, what it takes, what to take and when to take it. And let's take a closer look at the Social Security component. Before we do that, I'll give you a little quiz here. This will make you quite a hit at cocktail parties. Does anybody know, you can just answer to yourself, does anybody know who Ida Mae Fuller is, or was, I guess? Well, Ida Mae Fuller was the very first person to ever receive a Social Security check. She received it on January 31st of 1940. She received that first monthly check of $22.54. I think in 3 years that she was obligated to pay into Social Security, she paid in about $24.75 and collected, are you ready for this? $22,889 because she lived to age 100. And we wonder why the government's going broke. Here's a woman who paid 3 years at a total of $25 and received $23,000 over the course of her remaining life. So that's my trivia question and comment for the day. So today we're going to review the important components of Social Security benefits, and we'll start with a discussion of how Social Security retirement benefits are calculated. Then we'll discuss the options that may be available for anyone who has ever been married, and we'll end with our favorite topic, the role of taxes and your retirement plan. So how are retirement benefits calculated? Well, I bet you most people didn't know this, but any of us have worked, if you have worked, I have worked, we are eligible for Social Security benefits once we have worked for a total of 40 quarters. In 2009, you would qualify for a quarter of work if you had an earned income of $1,360. So the Social Security Administration uses something called your full retirement age, FRA, as a basis for calculating Social Security benefits. As you can see on this slide here, it starts at age 66 for anyone born between 1943 and 1945, and gradually increases to 67 for those born in 1960 or later. For anyone turning 62 this year, your full retirement age is 66 years and 6 months. So take a look at the chart to find your full retirement age. And for simplicity's sake, in this presentation, we're going to use the age 66 as our example for full retirement age calculations. And this is because age 66 is the full retirement age for anybody through the year 2020. So, knowing your full retirement age, and in this case age 66, makes it a lot easier to understand Social Security. If you take any benefits before 66, they'll be reduced. If you apply for any benefits after 66, the benefit will grow or are maximized, and we'll see this in just a second. But what I wanted to show was it's this concept of these quarters and the full retirement age. There's actually, kind of multiple pieces working there. It's not just one thing. So, if you claim Social Security before full retirement age, your benefits will be permanently reduced. So we can see we've got two individuals here whose full retirement ages are age 66 and age 67. And we can see here that if they apply and take their benefit at age 62, their benefit amount will be reduced about a quarter, maybe a little bit more. If they wait until their full retirement age, there's no, if you want to call it upside nor downside. But if you look at the far right and at age 70, which the Social Security calls the delayed retirement credit, it's not really delayed, but anyway, it's deferred kind of, but you can see actually about almost 8% per year, so a total of between 24 and 32% more in benefit. That's quite a bit. If you're younger than full retirement age, now this is something a lot of people, I think, don't really know about. If you're younger than full retirement age, there is a limit to how much you can earn and still receive full Social Security benefits. If you're younger than full retirement age during all of 2019, the Social Security Administration will deduct $1 from your benefits for each $2 that you earn above $17,640. If you reach full retirement age during 2019, the Social Security Administration will deduct $1 from your benefits for each $3 that you earn above $46,920 until the month you reach full retirement age. And this withholding applies to any Social Security benefit you receive. It affects your retirement, spousal, survivors, and the divorce benefits. If you are married, the Social Security Administration only looks at the earnings of the individual who is collecting Social Security before age 66. For example, wife is 62, retired, and receives her Social Security retirement benefit. Her husband is age 65, working and earning $50,000. The SSA does not care how much the husband earns. Earnings limits look at wages only. Unearned income such as pensions, individual retirement accounts, rental income, etc., does not cause Social Security benefits to be withheld while working and under the age of 66, or full retirement age in our example. Additional information, if you're really, are confronted with this, if you're collecting Social Security before full retirement age and then return to work, the SSA will recalculate your benefits as if you had applied 6 months later. For example, if you claimed your retirement benefit at age 62 and then later went back to work for 12 months, the SSA will recalculate your benefits as if you had, applied, at age 63, a full 12 months later. Mr. Technology is not being nice to me here. So we talked about our retirement benefits. Let's take a look at anyone who's been married and what those spousal benefits are all about. So the SSA also allows a spousal benefit. Even if you never work, you may receive up to 50% of your spouse's benefit at full retirement age. You could receive a reduced spousal benefit at age 62 of 32.5%, 35% of your spouse's benefit at their retirement age. In order to receive a spousal benefit, your spouse must have applied for his or her retirement benefit or filed and suspended. Some other important things to know are only one spouse at a time can receive a spousal benefit. If you both work, you generally receive the greater of your personal or spousal benefit. The spousal benefits are always based on your spouse's benefit at full retirement age, regardless of when he or she can claim Social Security. So let's look at a case study. Jack and Diane. Here we look at Jack and Diane. Two kids born, I forget, small town. So in the example here, we have Jack is the higher earner. Diane's retirement benefits are less than spousal benefits. Jack's annual Social Security retirement benefits at age 62 are $7,500, 66, $10,000, 70, $13,200. So this makes me think back to that previous chart where you see if you wait till age 70, you'll potentially receive a benefit almost double of what you would receive if you started receiving benefits at age 62. Pretty big difference. So if Jack claims the full retirement benefit at age 66, that benefit will be $10,000 a year. So what is the maximum Diane can receive as a spousal benefit while Jack is alive? Well, Diane can receive $5,000 a year. So that's 50% of what Jack was entitled to at full retirement age of 66. Now let's assume that Diane applies at age 62. What is the minimum spousal benefit at 62? Well, it's $3,500. Remember, if you do anything before age 66, your Social Security benefit is reduced, including your spousal benefits. Now let's assume Jack claims his retirement benefit at age 70. What do you think the spousal benefit is for Diane? Yes, Diane will receive 50% of Jack's age 66 benefit, or $5,000 if she claims at 66. But if she claims at 62, she will receive 35% of that, or $3,500. So how many of you got that right? How many of you maybe thought that would be higher? So the spousal benefit is always based on the other spouse's benefit at full retirement age, and in this case, age 66, regardless of when the spouse claims Social Security. Even though the retirement benefit increased after age 70, the spousal benefit calculation is still based on your spouse's retirement benefit at their full retirement age. Let's do one final example. Assume Jack claims at age 62. If Diane claims a spousal benefit at age 66, will it be 50% of $7,500, which is Jack's age 62 benefit, or 50% of $10,000, Jack's full retirement age benefit? What about the spousal benefit is claimed at age 62? Well, the answer, the spousal benefit is always based on the other spouse's benefit at full retirement age, and in this case, age 66. So you'll notice that Diane's spousal benefit at 62 remains the same regardless of Jack's age when he claimed his retirement. For example, Diane's spousal benefit at 62 is $3,500 regardless of whether Jack claimed at 62, his full retirement age of 66, or age 70. So how many of you were born before January 1st, 1954? For those of you that were, you may be eligible for a strategy called a restricted application. Under this strategy, you may be eligible to start with the spousal benefit and then switch over to your own retirement benefit. In order to do this, there are 3 requirements. You must be born on or before 1/1 of 1954. You must apply at age 66 or older, and your spouse must be receiving their retirement benefit. Because in order for you, in order for you to receive a spousal benefit, your spouse must be receiving their retirement benefit. If you don't meet all 3 requirements, then you will receive the higher of your retirement or your spousal benefit. So you can discuss this with your advisor and analyze how this strategy fits with your current plans for retirement income. So let's look at a case study that illustrates this restricted application. So we have Al and Abby, and Al is age 66, born in 1953, and the highest earner. He has plans to apply at age 66 or older, whereas Abby is age 62, born in 1957, and retired. Because Al was born before 1/1 of 54, he is eligible for restricted application. Remember, the requirements for restricted application are being born before 1/1/54, age 66 or older when applying, his wife receiving her retirement benefit. She can be receiving a reduced retirement benefit, and she can be born after 1954. The only spouse who has the age and birth requirement is a spouse who is electing restricted application. So here's what happens. Abby decides to retire and takes her Social Security retirement benefit. Since Al is age 66 and born before 1/1/54, he is eligible for restricted application. On his application, he elects to restrict his application to spousal benefits. This allows Al to start with the spousal benefit. If he wants, he can continue to work while receiving the spousal benefit. Then at any time between age 66 and 70, Al can switch to his retirement benefit. After he passes away, Abby receives his benefit because it is at the highest benefit level. So functionally, what we're really just doing here is we're delaying collecting on typically the lesser earnings spouse and allowing that benefit bucket to grow by virtue of deferral to an advanced age, like to age 70. If both spouses work, coordinating benefits can get a little more complicated. The first thing to consider is, has your spouse applied for their retirement benefit? If the spouse has applied for their retirement benefit, you are eligible for a spousal benefit. You'll receive the greater of your retirement or your spousal benefit unless you were born before 1/1/1954. In that case, you could be eligible for restricted application. If your spouse has not applied for their retirement benefit, you are only eligible for your own retirement benefit. When your spouse applies, you may step up to the spousal benefit if higher. However, if you are receiving a reduced retirement benefit, your spousal benefit will also be reduced when your spouse applies. Now, after the highest earner passes away, Social Security can provide benefits to the surviving spouse. The surviving spouse could receive up to 100% of the deceased benefit if the surviving spouse is full retirement age or older when he or she claims the survivor's benefit. Even if the surviving spouse is receiving a reduced retirement or spousal benefit, you can receive up to 100% of the deceased benefit if you are full retirement age or older when you apply for the survivor's benefit. The surviving spouse is eligible for a reduced survivor's benefit as early as age 60, 50 if the surviving spouse is disabled. The minimum benefit is 71.5% of the deceased benefit. The amount the survivor receives is dependent on when the highest earner claims his or her retirement benefit. The higher the deceased retirement benefit, the higher the survivor's benefit. So, how does the deceased claiming decision impact the survivor's benefit? It's easier to illustrate by looking at a hypothetical example. So in 2008, the average male would receive $21,000 in annual Social Security retirement benefits if he claimed at age 66. The difference in the survivor's benefit if he took at age 62 versus age 70 is almost $10,000. Could an extra $10,000 a year make a difference for some of you? For the highest earner in the couple, the Social Security retirement benefit is no longer your benefit, it's your couple's benefit. This is because the highest earner's benefit becomes the survivor's benefit after the highest earner passes away. Surviving spouses aged 60 to 66 may have a couple of additional options. Remember, the earnings limit applies to any benefit that is received before full retirement. If you are divorced but your marriage lasted 10 years or longer, you may qualify for benefits off of your ex-spouse. You can receive a spousal benefit off your ex-spouse's record even if he or she has remarried. If you are unmarried, you and your former spouse are age 62 or older, your ex-spouse is entitled to Social Security retirement or disability benefits. Unlike married couples where the spouse needs to apply in order for you to receive a spousal benefit, if you are divorced, your former spouse does not need to apply for their retirement benefits in order for you to receive a divorced spousal benefit. If you can provide the Social Security office with your former spouse's name and Social Security number, a copy of the marriage license and divorce decree, the SSA will check to see if you qualify for a benefit off of your former spouse. And this has no negative impact on the spouse that you're claiming against. And there can be multiple ex-spouses all claiming on the same spouse that they had been married to previously. As a general rule, if you remarry, you forfeit the benefits off your former spouse. There's two exceptions, though. If you remarry after age 60, you can hold on to the survivor benefit off your former spouse even though you remarried to your current spouse. Social Security Administration will pay you the highest benefit to you which you are entitled, either your retirement benefit, the spousal survivor benefit off your current spouse, or the survivor benefit off of your ex-spouse. So if you're age 58 and thinking of getting remarried, if your soon-to-be new husband makes less than your first husband, you may want to wait until age 60 to remarry so you can retain the survivor benefits off your ex-spouse. If the second marriage ends either through divorce, annulment, or death, you can become re-entitled to benefits and revert back to your first marriage. And this happened with my mom. This specific example. My father had passed away. She and her to-be husband wanted to get married. They found about this ruling and they delayed their wedding for a bit. And then when her second husband passed away, she reverted back to my dad's spousal benefit. On to the next section, and everybody loves this favorite topic, taxes. Now, people freak out when I tell them that their benefits are taxed. It's like a big surprise here. However, regardless of your age, once you start taking Social Security, your benefits may be taxable if your income exceeds $25,000 if you're single, or $32,000 if you are married and filing jointly. To determine how much of your Social Security benefits could be added to your income and thus become taxable, the IRS uses something called combined income. Combined income is your adjusted gross income plus tax-exempt income plus only half of your Social Security benefits. Now, by lowering provisional income, a taxpayer could possibly lower the percentage of taxable Social Security benefits or even avoid taxation on Social Security benefits altogether. For this purpose, adjusted gross income does not include any of the Social Security benefits reported to them on Form SSA-1099. One more thing to be aware of is that some items are not included in combined income, and these include Roth IRA and Roth 401ks or 403bs, qualified charitable distributions, say from a charitable remainder trust, non-taxable portion of pensions and annuities, inheritances and gifts, life insurance proceeds, and health savings accounts withdrawals for qualified medical expenses. So as you can see, Social Security claiming strategies can be complex and have many considerations. Working with a financial advisor and tax professional can really help you put some of this into perspective. Here are some of the questions to discuss with your advisor as you contemplate when to take Social Security. How long will you work? How long, or what is your anticipated withdrawal rate? And this is interesting, what is your combined life expectancy? In your family, do people live to 59 or do they live to 95? Okay, so that kind of ends our segment on Social Security. And now we're going to flip, whiz bang here, over to Medicare. Isn't that cool? So Medicare is a topic that every person nearing retirement needs to understand. And we're going to look at Medicare planning as a critical component of a retirement plan. We're going to learn a little bit about the nuts and bolts of Medicare Parts A, B, C, and D and help you make better and more informed decisions about Medicare. So let's start with the basics. What is Medicare? Medicare is a federal health insurance program for individuals age 65 and older who are disabled, or who are disabled, People can receive health care services under the original Medicare plan, Parts A and B, or by joining a Medicare Advantage plan, Part C, and prescription drug coverage is also available. That's Part D. So with paying for health care, one of the retirees' biggest concerns, and in fact the most commonly selected retirement threat, was reduced Medicare benefits by most people who were interviewed. That was ahead of reductions in Social Security market volatility and even insufficient retirement savings. So what is Medicare? In 2010, the most up-to-date figures available, the average amount spent on health care by couple aged 65 to 74 was approximately $5,000. However, it's estimated that those same couples will need around $261,000 to have a 90% chance of recovering all of their Medicare premiums and out-of-pocket health care costs over their lifetime. So it's not just about what health care costs today, it's about what health care costs tomorrow. So, with Medicare being a federal health insurance program for individuals age 65 or older who are, well, excuse me, I went the wrong way, my apologies. Okay, so the original Medicare program was composed of two parts. Part A, which covered major medical hospitalization, and Part B, which covered everyday hospital services. Over time, each part was expanded to provide more coverage, and Parts A and B are still the mainstays of coverage today. Medicare helps pay for insurance coverage for outpatient prescription drugs. Insurance companies and other organizations are approved by Medicare to sell this coverage. So Part D is a voluntary purchase, but enrollment in Parts A and B is required in order to enroll. Part D enrollment is required within 3 months of being eligible for Medicare, or there is a penalty. The one exception is that if the enrollee has prescription coverage under an employer or union plan, that's at least as good as the coverage under Part, that is at least as good as the coverage under Part D. So just kind of backtracking here a little bit, we can see that Medicare has these different components, A, hospital insurance, and B, medical insurance. And then this one that was kind of, during the Bush administration, kind of was expanded quite a bit and really became the most noteworthy topic was Part D. We heard about it in the news all the time. So Medicare is a great benefit, but it doesn't pay for everything. And that's why some people get some kind of, quote, gap coverage. If without supplemental coverage from an employer or union, an enrollee may buy a Medigap policy from a private insurance company. And this will help pay for any expense not covered by Medicare, as well as deductibles and coinsurance. These policies are regulated by the state insurance authorities within guidelines set by the federal government. But since they come from different companies, they may provide different levels of coverage. The premiums can also vary by company, coverage, and by state. And Medigap doesn't cover everything. For example, long-term care, vision, or dental care are not covered. Neither are hearing aids, glasses, or private duty nursing. So with Medigap, we have 10 different standardized plans, A, B, and so on. Plans cover costs like copayment, coinsurance, and deductibles. And standardized plans must all offer the same benefits. The cost is usually the only difference between policies, with the same letter sold by different companies. In some states, including looks like Massachusetts, Minnesota, and Wisconsin, are standardized in a different way. Another option for supplemental coverage is Medicare Part C, also known as Medicare Advantage. This program is still part of Medicare, but coverage is provided by private insurance companies. For that reason, pricing and some aspects of the coverage may vary. For those who join a Medicare Advantage plan, get all of the medical coverage covered by Parts A and B. In addition, some plans may provide additional benefits to help cover costs. And I believe sometimes these plans were called, kind of or Medicare HMOs. I remember that phrase. Oh, here you go. Perfect. So there's 5 types of Medicare Advantage plans. They're HMOs, PPOs, private fee-for-service plans, special needs plans, and medical savings accounts. And each plan has its advantages, so careful consideration is required before deciding on which type of plan is used. And currently today, 83% of Medicare Advantage plans are either HMO or PPO plans. Now let's take a look at some of the pros and cons of original Medicare. Some of the advantages are that original Medicare allows you to pick and choose which coverage you want. Want more coverage? Then pay more in premiums. Another advantage is that most doctors and hospitals will accept original Medicare as a form of payment, and this allows more access to health care across the county. If enrolled in, it says country, if enrolled in original Medicare and then moved to another state, the coverage remains the same. Some of the disadvantages of original Medicare is that it's an 80-20 plan. And that means that Medicare only picks up an average of about 80% of the cost of care. And you're on the hook for the remaining 20% unless you've purchased an additional Medigap plan. This additional coverage results in higher monthly premiums. Also, dental and vision insurance is not included in Medicare and has to be purchased outside of original Medicare. Now we'll look at some of the pros and cons of Medicare Advantage. Medicare Advantage is the private insurance company's version of Medicare. It has all the same components of original Medicare, but the U.S. government allows private insurance companies the ability to add additional benefits and sell them to the general public. Some of the pros of Medicare Advantage are that you get all your health benefits in one package. These Medicare Advantage plans can also include dental and vision insurance along with health care benefits that are not available in original Medicare. Another advantage is that some Advantage plans can include out-of-pocket maximums. Costs are the biggest question on most individuals' minds, so let's take a quick look at those associated with original Medicare. If, like most individuals, modified adjusted gross income is below $85,000 for filing individual and under $170,000 for filing married jointly, then the above scenario is typical. We'll discuss what happens later if the modified adjusted gross income is higher than those numbers. So Part A is premium-free if enrollees earned for 40 quarters. Part B, for those below the MAGI levels, will be around $134 a month. If buying the prescription drug benefit, the Part D premium will be in the neighborhood of $30 to $60. And the amount will be determined by how robust coverage is and also the state in which the person lives. The final option is purchasing a Medigap policy. Only about 35% of Americans purchase one, and depending on the plan purchased and how much of the original Medicare coverage gap is covered, the cost can range from $50 to $250 a month. And these costs can also vary by state. Purchasing all of the above and looking to cover as much of the original Medigap as possible is around $350 per month per individual. And again, remember, these costs vary by state. So Medicare Advantage costs vary as well, depending on the extra benefits added onto base coverage, and the state will determine the overall monthly premium costs incurred. The base amount paid will be determined by the Part B premium. For most individuals, that will be $134 a month. And then depending on the additional benefits, deductibles, out-of-pocket maximums, and the state you're living will determine the final cost paid for Medicare Advantage. Part B premiums are based on reported personal income. The higher the income, the larger the premium until it reaches the maximum amount. So we can see here, individual joint, the monthly payments will range from $134 monthly to $428 monthly. And here we have a Part D premium with prescription drug plans. So Part D premiums, or the prescription drug plan, are determined by the policy offered. If personal income is above a certain level, premiums will be subjected to an adjusted amount paid in addition to the standard premium. Much has been said about the Part D donut hole. The Part D drug benefit provides initial coverage up to a certain level. But in most cases, there's a gap in benefits before coverage kicks in. This gap is known universally as the donut hole. I think we could come up with a better analogy than that. The Health Care Reform Law of 2010 generally closes the coverage gap, or the donut hole. From 2006, when Part D began, through 2010, falling into the gap meant having to pay 100% of the costs. But starting in 2011 and forward, it's much less, and it works like this. Once total drug costs, what the plan pays plus the deductible and co-pays, exceeds a certain amount, which is $33.10 in 2016, from the beginning of the calendar year, the gap opens. While in it, the enrollee pays 45% of the cost of brand name drugs and 58% of the cost of generic drugs. So here's some real-life examples of original Medicare costs in Georgia, retired age 65 with $70,000 in annual income. So we can see we've got 0 for Part A, 134 for Part B, 34 for Part D, and 180 for the Medigap plan, for a total of $348 per month. We've got Medigap covers co-pays and deductibles for Part A, B, and D. And when I said Georgia, I thought I meant the state. It's this person. She pays, Georgia, pays for dental, vision, and any long-term care costs. So here's David, retired age 68 with $60,000 in annual income. He's got 0 for Part A, 134 for Part B, 37 for an average plan premium, 171 total for each premium month. So you can see that difference in income here, 348 versus 171. But now in this case, his out-of-pocket expenses are going to include co-pays on the services he uses and prescriptions. He pays for dental, vision, any long-term care costs, and he pays for out-of-pocket for services outside his network. So it's kind of a function of both, that his income's different and he did not elect additional coverage. Here we got Patricia, retired age 71, $120,000 in annual income. Wow. Medicare, I want to figure out how she's doing that. Medicare Advantage with prescription drug coverage, 0 for Part A, 267 for Part B, 37 average plan premium, 300 in total premium payments per month, and yet her out-of-pocket expenses include co-pays on the services she uses and prescriptions, and she pays for dental, vision, and any long-term care costs. She pays for out-of-pocket for services outside of her network. Now that we've covered the basics of Medicare coverage and costs, how do we enroll? Parts A and B, if eligible when turning 65, sign-up can happen during the 7-month period beginning 3 months before the month one turns 65. and this includes the month you turn 65 and ends 3 months after the month you turn 65. If you're not signed up for Part A and or Part B when first eligible, it's possible to sign up during the general enrollment period between January 1st and March 31st of each year. If covered under a group health plan based on current employment, there's a special enrollment period to sign up for Part A and or Part B anytime as long as the enrollee or the spouse or family member, if the enrollee is disabled, is working and covered by a group health plan through the employer or union based on that work. An eight-month special enrollment period to sign up for Part A or Part B that starts a month after employment ends or when the group health plan insurance based on your current employment ends, whichever happens first. Another thing to keep in mind with enrollment in Medicare supplement plans or Medigap plans, a Medigap plan may be purchased without underwriting when enrolled during the first 6 months of age 65 and having been enrolled in Part B. If this window is missed or there's a desire to change plans during the annual enrollment period from October 15th to December 7th, it might be subject to underwriting. Underwriting means that they're going to evaluate your health and determine if the insurance company, if they decide to cover you or not. Enrolling in the prescription drug plan is fairly similar to Medigap plans. It must happen during the initial enrollment period or face a penalty. There may be a penalty if enrolled at any time after the period is over, and there's a period of 63 or more consecutive days without Part D or other creditable prescription drug coverage. That penalty is multiply 1% of natural base premium times the number of months without coverage. And you can change your prescription drug policy each year during the fall window from October 15th to December 7th. Every year, there's an option to switch policies during the open enrollment period from October 15th to December 7th. Enrolling in prescription drug plans is very similar to Medigap plans. It must happen during the initial enrollment period or face a penalty. There may be a penalty if enrolled at any time after the period is over, and there's a period of 63 or more consecutive days without Part D or other creditable coverage. So, what things to consider when deciding which Medicare plan to enroll in? And they can include health care needs, what plans cover needed services, do you have any other coverage, what are the costs, what are the choice of doctors or hospitals, what is the prescription drug coverage, what is the perceived quality of care, how convenient is it, and is travel an issue for you? Here are some resources that you can refer to: the Center for Medicare and Medicaid Services, the Social Security Administration, and the State Health Insurance Assisted Program. Also the Elder Care Locator. So with that, I'll say thank you, congratulations, you made it. Thank you for joining me, Brian Sikorsky. As I mentioned, I've got this recorded. I'll be uploading it to my YouTube channel. It should be there tomorrow. And if you'd like to review this again, you can do that at your convenience. If you have any questions,